So, as I said earlier, much of the work here, and as you've mentioned in Edinburgh, it's been led by my former colleague, Margaret McQueen, and in conjunction with her colleague, Charles Court Brown. And I think maybe just before we move on, what we should highlight is a lot of the research from Edinburgh and a lot of the research we're talking about has been done for acute compartment syndrome following tibial diaphyseal fractures. Now, some of it is you can spread it to other risk other causes, but it is a lot related to that, which we know is the most common cause of ACS. So here in Edinburgh, Margaret and Charles started publishing about compartment syndrome in the late 80s. And this progressed rapidly through the 90s into the turn of the century, where they really established the potential role and benefits of pressure monitoring using a slit catheter technique, which is a relatively cheap technique that we still use today. They had emphasized the importance of the differential pressure rather than the absolute compartment pressure. So this idea of the diastolic pressure, which is the lowest pressure going through the limb, reverses the minus the resistance, which is the absolute pressure, and that concept in the delta P of 30, which has been, I think, reasonably well proven as a reasonable cutoff, but again, we could talk about that. And then this idea of the trend over time, not using a one-off management, using a continuous pressure measurement, and looking at that trend and how that is very useful and a lot more accurate than a single one-off measure. And that work sort of accumulated in two publications, one in 2013 and 2015, looking at how monitoring performs, so the diagnostic performance characteristics, which were very, very good. But I think with all of these studies that look at that, you've got to remember we've got no reference standard. We've got no way of definitively saying whether they definitely did or did not have compartment syndrome, but it performed very well, certainly better, no matter what literature you read, better than looking at clinical symptoms and signs in isolation or even combined. And also, I think the big work was looking at who's at risk, who gets compartment syndrome. And I think one of the big studies that we did in 2015 was looking at actually the most important thing is youth. It's young patients really more than anything. And the theory behind that is that they have a bigger muscle bulk, they have less room to swell in their compartment. And I think that's why it's really important. But having knowledge of that epidemiological data and risk factors is really important because it helps us identify who we should really be monitoring.